We are presenting a new method for the diagnosis of dizziness. In dizziness or vertigo, symptoms can be caused by many different diseases, and it's quite common, affects 50% of all people over 65 years. In 50% of these patients, symptoms are caused by a disease in the balance organ. It is therefore very important to make a correct diagnosis. Today, many diagnostic methods are used. One important is the vestibular evoked myogenic potential, VEMP. It is a muscular reflex evoked by a mechanical stimuli of the vestibular organ. It can be either cervical, cVEMP, or ocular, oVEMP. Today, often an air conduction speaker is used in the ear canal. Problems encountered are that you need up to 135 dB SPL, which is very uncomfortable and implies a hearing hazard. In patients with a conduction hearing loss of more than 30 dB, it is even impossible. Here you can see a cVEMP recording using an air conduction speaker and a not so happy patient. It's also possible to use a bone conduction stimulation. Here, VEMP is independent of the hearing loss. But if you use an audiometric transducer, the B81, with a resonance frequency of around 500 Hz, it is not powerful enough, especially not at low frequencies. Instead, you can use the mini shaker BNK4810, but it's quite big and clumsy. Here you can see an oVEMP recording using the mini shaker, and you also see that second personnel is needed. Now, we have developed a new low-frequency transducer, the B250. It has a resonance frequency of 250 Hz, where it is very strong. Here you see an oVEMP recording using the B250 and the steel spring retention. And you also see a much more happy patient. Using the B250, we get very nice cVEMP and oVEMP recordings, and the main conclusions with the B250 are that we now can do VEMP investigations at 30 to 40 dB lower hearing level, which is more comfortable and implies no hearing hazard. VEMP is also independent of a hearing loss. All patients can be investigated.